Hi everybody, it's Dr. Eric Balkavich and I'm back for another edition of Thyroid Thursdays. Today we're going to continue on our hypothyroid series where we talked about the 6 most common patterns of hypothyroidism. Now there's probably 24 or more ways that the thyroid physiology can be disrupted, but we're talking about the 6 most common ways that somebody can have, or 6 most common reasons that people can have hypothyroidism. So we've talked so far about 4 of them. Today we're going to talk about the 5th one, and that's called thyroid binding globulin elevation. Last week we talked about deficiencies in thyroid binding globulin, and we said in females, #1 cause is insulin resistance, causing increased testosterone levels. And when we have increased testosterone levels, we have lower levels of thyroid binding globulin. There's less thyroid hormone bound into the taxicabs. More thyroid hormone free is floating free. And while we thought initially that may sound like a good idea, because if you have hypothyroidism you would want more free T3 floating around the system, but what I discussed was if you have too much, the tissues can actually become resistant to the thyroid hormone and not get the thyroid hormone into the cells. So this week we're going to talk about thyroid binding globulin elevations, and in this situation we've actually got too many of these thyroid binding globulin, or these taxis that carry the thyroid hormone around the body. And so if we have lots of taxicabs or lots of carrier molecules, then we have lots of room or lots of capacity to take our T4 and our T3 and put it in the taxicabs. The problem is if we have lots of thyroid binding globulin, it kind of holds it into those carrier molecules, and it leaves it less available to get into the cellular system, because it's only the free hormone that actually does the work. So you kind of think about this like being at the airport. If I was at the airport and there was tons of taxi cabs and no other passengers, I'm going to get a ride in the taxi cab, but the driver's probably going to take the long way to my destination, trying to keep me in the car as long as possible so they can charge as much as possible. If I was at the airport and there was only 1 taxi cab or 2 or 3 taxi cabs and tons of people, the taxi cab drivers will load me up, get me to where I need to get to, and get back to the airport as quick as possible to make as much money as possible. In thyroid physiology, if I've got lots of thyroid hormone and very few taxi cabs or carrier molecules, that thyroid binding globulin, then we typically have the thyroid overconversion issue going on. If I've got lots of taxi cabs in proportion to my thyroid hormone, then we've got this thyroid binding globulin elevation going on. So I've got lots of that. I'm not getting as much free hormone floating around the system, and that can cause me to have hypothyroidism. So lots of thyroid binding globulin, lots of hormones stuck in the taxi cab. Our free thyroid hormones are going to be lower, and if our free thyroid hormones are going to be lower, I have less free T4 to activate riboflavin to do a whole bunch of different processes in the body, and I'm also going to have less free T3 floating around to get in, activate the cellular system to increase our metabolism. So in this situation, if we run a traditional lab panel, TSH is going to be normal, T4 is going to be normal, T3 is probably going to be normal, free T4 is going to be low, free T3 is going to be low as well. We see reverse T3 that the T3 that's converted into the wasted T3 is probably going to be normal, could even be low. Thyroid antibodies will be negative because this isn't a thyroid antibody issue. When we talk about T3 uptake, we talked about when T3 uptake is low, that means there's a lot of thyroid hormone bound to the thyroid binding globulins. When T3 uptake is high, that means there's a lot of availability for thyroid binding globulin, or to bind more thyroid hormone. In this situation, T3 uptake is probably going to be normal, but it could also be high, because if I have lots of taxi cabs in proportion to my thyroid hormone, there may be more room for binding to occur. So we may see this normal to high. I think the big key things we want to look at in this pattern is what's free T4, what's free T3. If those guys are low and T4 and T3 are normal or high, then we know we've got this thyroid binding globulin elevation. In this situation, we want to go back and look at our patient's history. The biggest causes of this is excess estrogen in the body, and you can pretty much guess that anybody who's taking birth control pills or somebody who's been put on hormone replacement therapy is probably going to have this issue going on. Even though estrogen is blamed for a lot of the symptoms of menopause, I think it's a little bit more complex than that. But we've got to be careful with estrogen support, because if we increase the estrogens, we increase the thyroid binding globulins. If we increase the thyroid binding globulins, then we have less free hormone. If we have less free hormone, then we're going to have hypothyroid symptoms. We're going to be moody, temperamental, and put on weight. So in this situation, we've talked about thyroid binding globulin elevations. That's the 5th of our most common hypothyroid patterns to understand. Again, it reiterates the importance of doing a full or a comprehensive thyroid panel. Hope you got that information. Hope that was helpful. I'll talk to you next week on another Thyroid Thursday.